Battle of the Borderlies in an hour, a beefy Great British menu to chew on at 9. Your body uncovered first.
Just imagine we could understand what's wrong with our bodies by actually looking inside them.
Wow, that is something. That's amazing.
This series is all about helping families who, just like mine, are trying to get to grips with health challenges.
It's always there in the back of your mind.
It takes away your happiness.
I just want to know the truth about what's happening in my body.
By bringing people together with state-of-the-art technology, let's flip the visors down on our headsets. We'll let them literally see beneath their own skin.
So let's peel away the bones. Wow, look at that.
Gosh, I have never seen anything like this.
Is that my prostate? It's like a big haggis.
It's just really incredible to see inside me.
Working with the country's top doctors, they'll have a medical consultation that will truly astonish.
So you can see the healthy uterus here, and this is yours.
Just to say, these are your breasts.
Helping them to not only understand their condition,
That is what's causing your pain.
Oh, really? Oh, truly, that looks startlingly different, doesn't it?
but also make the key treatment decisions they need to get better.
What we'll be doing is removing all of the left lobe.
You can see it's shrunk right down to almost nothing.
Now I can see it for what it is, and I want to get it removed, and I want to be better.
Oh, bless you.
I'll be there for every step.
How's my brain?
As we use the power of technology
Incredible.
to bring hope to our lives.
Knife, please. I will never see life in the same way again.
So thankful for the care that you and your medical team. Without you, I wouldn't be here today.
This is your health as you've never seen it before.
Quite handsome, isn't he?
The one thing about having a serious health problem is you feel out of control. The thing that you rely on to live, your health and your body, is in jeopardy. So the more knowledge you have, you just have a little bit more power in your elbow to cope.
In this series, we're bringing patients and their doctors together in our unique imaging centres, where they'll have a mind-blowing consultation to get to grips with their condition from the inside out. With the help of consultant Dr. Goody Singh,
So let's have a look at the scan, shall we?
they'll get the ultimate insight into what's really going on inside their bodies.
With the latest technology and augmented reality, we're going to show you your body in a way that you've never seen it before.
First to one of our imaging centres is 73-year-old Tina, joined by her daughter Kirsty.
Kirsty is my pride and joy. I love her to bits. Oh, that's when we went snorkeling.
Snorkeling. There's something that is a bit scary or risque. We're up for that.
Oh, that was great. That was on the quad bike. Any opportunity to do anything like go-karting or anything stupid like that, I'll have a bash at because I think it's fun. And that's what life's all about, isn't it? It's for living.
But in the last 12 months, Tina has started to suffer from painful and at times peculiar symptoms that have put her all-action lifestyle on hold.
I suppose I was hoping it would go away, but I realised then it wasn't going to go away.
Tina is now under the care of a small team at St Mary's Hospital. Joining us in our imaging centre is her consultant, Dr. Dimitri Amiras, musculoskeletal radiologist at Imperial College Healthcare NHS Trust, who reviewed her initial scans.
We can see quite clearly some abnormalities here which would fit with her symptoms.
With her condition steadily worsening, Tina is desperate to understand what is happening to her and what, if anything, can be done to alleviate her symptoms.
I feel that I've aged almost overnight with this, and it's made me feel like a 73-year-old, although I didn't feel like that before. I mean, I'm hoping it's not my fault because I've had a pretty active life, and I'm praying that the 3D image of it all will give me a far better understanding.
Hello.
Hi.
Well, it's nice to meet you.
You too.
So when did you first have a symptom? When did you first think, that's a bit strange, what's going on?
I would say about a year ago, and I started to get a tingling sensation in my fingers, like pins and needles, but it just didn't go. And I can't feel anything, I can't feel texture. I can't do up buttons, I get shooting pains up my arms.
Gosh.
Because the pain is quite intense. It's affected my balance, all sorts of things.
So sometimes we'll walk off somewhere really quickly and not forget about her, but just assume that she's walking with us, and then you think, oh, Mum, and you have to sort of turn around and make sure that she's all right walking because she's unsteady on her feet, and she gets frustrated with that.
It must be hard to watch your mum, Kirsty, effectively sort of deteriorate before your eyes.
It's an emotional thing to watch your mum every day getting worse.
You've gone from being the sort of person that would do things like paragliding and parachuting and all that sort of stuff to suddenly feeling like you can't do up your buttons.
It's frustrating. It is so frustrating having to ask for help.
And what did the doctors say in the first instance?
I think there's something wrong with your spine.
Tina has been diagnosed with cervical spondylosis with myopathy. Cervical spondylosis is a spinal condition that affects 9 out of 10 adults by the time they're 60. Fortunately, many won't even notice, and only 10% will get long-term neck pain. Symptoms can range from severe shoulder pain, loss of balance and feeling in the limbs, to trouble walking, and in the very worst cases, full body paralysis.
So you've got pain, numbness, feeling of being unstable, and you can't do the things you love anymore.
I want to do everything as any normal human being would. You just want to get on with your life, and I can't.
So what are you hoping will come out of today? Do you have questions that you want answered?
Oh, so many. I've got so many questions. I just want to understand it and have it explained to me. And I'm interested to know what's caused it.
Hello. Hi, Tina.
Hi.
Lovely to meet you.
You too.
Dr. Goody is taking Tina through to our imaging centre, where for the first time she'll meet Dr. Dimitri Amiras, the consultant who can explain her symptoms from her scans.
This is Dimitri.
Great, I've seen the scans and now I get to see you in person. This is fantastic.
I'm looking forward to learning so much today. Look forward to it.
Follow me.
Using the scans of Tina's head and neck, we've built incredible 3D images to help her get to grips with her serious condition.
You want to jump up here?
Having seen her mum's health deteriorate, Kirsty is also keen to know what's going on.
So, Tina, we're about to see your spine. Are you ready for this?
I'm so excited.
I'm watching her and seeing how excited she is about it. I'm just also, you know, you've got that...
And checking she doesn't fall over.
Yeah.
Shall we put our headsets on?
Okay. Oh, gosh. Oh, wow. I'm absolutely awestruck at what I'm seeing.
This is your skull, and this here is your spine. This
Wow.
is your neck. So this is what's been causing all of your problems.
gosh, I have never seen anything like this. I just can't believe that's my body.
So amazing.
It's incredible.
This is your neck and the bones in your neck. And Dimitri, can you explain to Tina exactly how these function normally?
So when you move your neck forward or back or to the side, all these joints will move.
The spinal column is made up of bones, muscles, tendons and nerves. The backbones, or vertebrae, are each separated by discs.
Does the disc go in there?
No, so the disc is, if you look at the vertebra, in between each vertebra, there's a bit like the filling in a custard cream.
Right.
So those discs there provide the support to support the weight of your head on your spine. And they're a shock absorber, basically.
The discs are crucial to the health of our spines. These spongy cushions separate the vertebrae and prevent the bones from grinding against each other.
What is the texture of a disc? Because I thought it would be sort of like silky spongy.
Yeah, so in the middle, it's kind of spongy. So when a force is exerted on it, it doesn't just spring back, it slowly absorbs that force.
She really is curious, though, isn't she?
I know. She needs to understand something inside out before she trusts it.
Shall we understand a little bit more about what's happening to the discs? Because the discs are actually key to your symptoms.
Okay.
Okay, so this is what a normal disc should look like. This is one of yours.
Wow.
So have a walk around your disc here. So you can kind of appreciate the thickness of this one.
Yeah, it's nice and spongy, this one. It's quite thick. And that's what it should be, because it's like a cushion between the bones in your spine.
Okay.
So I'm going to take out another disc. So you can see this disc here, and this is where things are starting to get less good. And you can see the difference already.
It's thinner?
Yeah, a lot thinner.
Yes.
It's like somebody's gone over it with a rolling pin. It's squishing it.
Yeah, and it's sort of gone out to the sides.
So you can see how they've worn differently. Actually, the disc, I think below it, is also equally affected.
That's that one here. Can you see where it's like it's a very thin sandwich filling, just there. So you can barely see it, it's that thin.
Really?
This is a slipped disc. And you might have heard that word.
Very
Some
much
of the doctors
so.
might have said that.
Yes, yes.
These two slipped discs are key to understanding Tina's symptoms. Until recently, life has been one big adventure for Tina and Kirsty.
That was the dolphins that we did. Zip lining.
Yeah.
Fantastic.
But the pain Tina has to endure because of her condition is making even the simplest tasks unbearable.
My hand is quite painful insofar as the tingling and the numbness. Oh, darling, could you just do me a favour? And the pain stops me from lifting anything heavy, from sitting in one position for any length of time, and I think it's interfered with my balance as well. Thank you very much.
Tina's pain is now such a handicap, it's stopping her getting her regular dose of exercise.
I'm a very bad golfer, but I just love the fresh air. And now with the spinal problem, I've been told by the doctors that would hurt my back. Oh, great shot. Well done, darling. When they told me that they knew exactly what it was, I think I cried because I'd got to the stage that it just got too much for me.
To provide a deeper understanding of Tina's painful condition, next Dr. Dimitri wants to explore her nervous system.
So what we're going to do is take away the skull. And then you can see the brain.
Oh.
And you can see how it's connected to this piece here, which is the spinal cord.
That's the spinal cord.
Yeah, exactly.
So
Yeah.
it's starting from there, going down.
You can see the little things that are coming out like little hands.
Are these nerves?
Exactly.
Branching off Tina's spinal cord is a network of nerves that help control motor, sensory and other functions in the body.
So I'm going to lie down, Tina, if that's okay. Okay, now you're lying down. So here you can see your spinal cord and your nerves coming out. And over here, we can see where the nerve is being pinched by the disc and a bit of bone pointing out.
As the discs in Tina's spine become more squashed, small bits of bone grow in the surrounding vertebra to stiffen the spine. The discs and these bony growths are now pushing on the vital nerves either side.
That is what's causing your pain.
Oh, really? Wow. So it's the fact that the nerve is compressed that is causing the pain. It's mind-blowing. Having it explained to me is amazing, absolutely amazing, and seeing it real life, wow. I think it's made it far clearer for me. It's fantastic.
But there's another problem deep inside Tina's spine that has far more serious ramifications.
This is where it's the worst.
And Tina has a tough road ahead of her.
If this isn't corrected, it will lead to paralysis.
That's pretty scary, isn't it?
When faced with a complex diagnosis like Tina's, the medical terminology can be baffling. But surgeon and clinical lecturer Dr. Karan Rajan is on hand to help.
When I was starting medical school, I didn't realize I'd have to learn a brand new language. The language of medicine. All this medical jargon can be very confusing for patients, but I'm going to break it down for you. Benign, not cancer. Malignant, cancer. Adhesions, scar tissue from surgery. Chronic, long-term. Acute, sudden or severe. Itis, inflammation. Indolent, slow-growing. Aggressive, fast-growing. Indeterminate, not sure. Incidental, unexpected. Anterior, front. Posterior, back. I might be fluent now in the language of medicine, but I certainly wasn't when I first started medical school.
Deciphering medical lingo is one thing, but understanding information on scans takes years of training. Our groundbreaking 3D technology makes that information more accessible, helping patients get to grips with even the most complex conditions.
Hello, Kate. Good to see both of you.
Joining me next in one of our imaging centres is international couple Annabelle and her husband Grant.
Do I detect an accent there?
Yes, I'm French.
Very nice French accent. And Grant, where are you from?
I'm from the United States originally.
So how did you two come to meet?
We were in Cambridge at the same college.
There's a lot of memories here. Where shall we start?
From across the Atlantic Ocean and the English Channel, this couple came together at university, falling head over heels as 20-something-year-old students.
I think this one is so good.
They firmly put roots down in England when they tied the knot in 2012. 3 years later, technical expert Annabelle and entrepreneur Grant had the first of their 2 children, Mallow, followed by Margot.
This is going to be my
When we learned that Anna was pregnant with our 3rd child, we felt a great amount of joy. That was a moment that really felt that our family was complete.
But as the couple eagerly awaited the arrival of their newest member, they were hit with a bombshell.
When I was 8 months pregnant, I found a lump and on my chest.
Okay, you can do one. You know, it's strange because lumps can happen, and especially in pregnancy. So when Anna told me that they'd found a lump, I don't think any of us really thought it was that serious.
How about this?
When we met for the diagnosis, we were told that I had an aggressive form of breast cancer.
I'm just terrified because all of a sudden you're staring into the abyss.
Breast cancer is the most common type of cancer in the UK. Around 55,000 women and around 350 men are diagnosed each year. It accounts for 15% of all newly diagnosed cancers.
When you hear the word cancer, obviously you think of the most sinister part of it. And so, I mean, for me, I was like about to give birth, and all I could think was like, I will have 3 young kids, and they're not going to know me. You know, that's not what I want for my children.
With just 2 weeks to go until Annabelle was full term, her doctors decided to induce her so treatment could immediately begin.
Annabelle has had to face a terrifying decision. If you're expecting a baby, you are just wanting to revel in that. And then on your maternity leave, you just want to indulge in this new little life. And instead, she was facing up to treatment to save her own life.
During that time, I just couldn't think about the cancer and the diagnosis. I let Grant dealing with everything, actually, and I just tried to focus on giving birth and welcoming our child, because it was too much.
2 days after the diagnosis, Annabelle gave birth to a beautiful boy. She immediately began an intensive 5-month course of chemotherapy with the hope of shrinking the tumour before she has surgery in a few weeks' time.
You've been battling hard, you've been going through the chemotherapy.
So I have just finished 5 months of chemotherapy, and I'm at the end of it now. Big breath.
What do you want to come out of today?
We're really, hoping to see like how it was before and what the effect of chemotherapy has done to it.
You just want to get in there and see it, and see how the chemo has affected it.
Exactly.
In our imaging centre is Annabelle's oncologist, Professor Jean Abraham of Cambridge University Hospitals.
Breast cancer treatment is really, for many women, a very long journey, and it really depends on the type of breast cancer as to what that course of treatment is.
Jean has analysed all of Annabelle's hospital scans, so she'll be able to show her first what her tumour looked like when it was originally detected, and then what it looks like now following the 5 months of chemotherapy.
Professor Abraham.
Annabelle, Kate, would you like to come through to the consultation?
Grant, I know you're going to wait outside, and we'll come and see you later. All right? After you.
Thank you. Come on through. Thank you. Grab a headset.
So you saw that original scan, you knew the challenge ahead, but this is a chance for you to see that original diagnosis. So should we put the kit on?
Oh, wow.
Wow, it's extraordinary.
Yeah, absolutely.
Just to say, these are your breasts. The one here on this side is the one that's been giving you all the challenges that you've been facing over the last 5 months and going forward as well. So this is the outline.
Yeah.
But of course, what you want to know
is the inside.
Is the inside, exactly.
For the first time, Annabelle will be able to see in 3D how her tumour looked before she started chemo.
So this is the tumour.
Correct.
I think that's extraordinary.
It's big.
That looks big.
Yeah.
The size is surprising, isn't it, when you see it in reality?
God damn it. It's huge. It's one thing to see it on paper. Seeing it there, it's big.
The average size of a tumour at the time of detection is 2 centimetres. At diagnosis, Annabelle's tumour was 8 centimetres, quadruple the size.
If you could show us, where did you feel?
Here, so...
Okay.
Because I felt like a little, it was like quite brown and smooth and a bit like a little sausage. Is it reason why it has that shape? Is it specific to my type of cancer?
Actually, breast cancers are often irregular and not very circular and round. Why don't you both come round to this side and we'll have a look. What you can see here is essentially a sideways cross-section of the affected breast, so the right side.
Hospital scans can show the shape and size of Annabelle's tumour, but to understand its composition, a biopsy was taken at diagnosis. Examination of a small sample of tissue by a pathologist is the only way to be certain if an abnormal area is cancerous. The type of cells inside the tumour will determine how aggressive it is.
So with the tumor, is it the same all the way through, or is it like different?
Often what happens is at the centre, the blood supply that the tumour has is not as good as further out, and so you might have some dead cells, and that might mean that there is a question mark whether the drugs can also reach that quite so effectively.
Unfortunately, Annabelle's is a particularly aggressive form, only found in 15% of breast cancer patients.
Yours is called triple negative. That is a big tumour, and that means that we know we have to treat it fairly intensely.
Faster-growing triple-negative breast cancer doesn't respond to hormone therapy, which uses medicines to slow down or arrest growth. Targeted cancer drugs aren't routinely used to treat this form either.
You wonder, like, how long it has been growing for?
Yeah.
Can we tell?
I suspect that it would have been weeks to months, not...
Oh, really?
Yeah.
Weeks?
Yeah.
Oh, wow.
And particularly in women who are pregnant or just immediately post-pregnancy, there's a lot of change of hormones, which can make that even faster.
It's quite scary to know that, you know, in a few weeks, few months, it can develop like that.
I kind of want to know if it's just literally dividing or if it needs something to feed it.
Yeah. So you can see here the blood vessels on the left side, which has got no breast cancer and is normal, compared to the right side.
Wow. It has diverted some of the blood supplies for its own growth.
It's quite a smart disease, cancer, in that it's trying to feed itself and trying to keep itself nourished and keep growing. And so that's why you can see more blood vessels.
It's disturbing. So it's like it's drawing nutrients and sustenance into it.
To treat the tumour, Annabelle was offered a clinical trial drug as well as chemotherapy.
So to stop me playing favourites amongst my patients, our computer actually picked your treatment, didn't it? You were actually allocated the tablet as well as the chemotherapy.
I was happy with the computer.
Why is it not possible when you see the size of that tumour to cut it out? Because that must be a first instinct, isn't it? Get it out. Yeah.
There are different ways to manage breast cancer, and the main reason that we do upfront chemotherapy or neoadjuvant chemotherapy is to try and make the surgery easier.
Post-diagnosis, Annabelle and Grant wanted to be open with the children about her illness.
We told them in a very matter-of-fact way, in a very scientific way, about what the disease was, that it's cells that divide more than they should, and they don't know when to stop. You know, you're trying to raise 2 growing kids and a newborn, but that didn't leave us a lot of time to think and ponder about things that we had no control over.
5 months of chemotherapy, coupled with the trial drug, took a heavy toll on Annabelle.
Chemotherapy is quite challenging. At the beginning, it starts okay, and then it starts like hitting you harder and harder. I was extremely tired.
It's strange that the disease itself, doesn't show symptoms. It's the treatment that shows symptoms. I was surprised at how tired it made Annabelle. I mean, to the point where some days she couldn't even climb the stairs, and her mental tiredness as well.
I couldn't be able to really look after the kids. And like all the time I had to be at the hospital for appointments. This time I couldn't spend with the baby. I got a bit of this time stolen.
There have been moments when I've been alone. It has scared me, and it continues to scare me.
In our imaging centre, Professor Abraham wants to show Annabelle in 3D whether the cocktail of drugs she prescribed has shrunk her 8-centimetre tumour.
So this is where we were when we started. This large, craggy-looking cancer.
And this is what we wanted to get as small as possible.
So shall we see how it went?
Wow.
Yeah, that's nice.
That must make you feel amazing.
Yeah, that's nice to
Oh
see.
my goodness. Yeah. So we can still see the outline of the original tumour. And then there's just that tiny, tiny centre bit.
Wow.
That is extraordinary. You can see it's shrunk right down to almost nothing.
I can really see like the difference now, obviously, from this 80 millimeter down to 4.
Are you particularly pleased with this, Jim?
Yeah, no, this is an amazing response. To have gone from such a large area to such a small area is fantastic.
I didn't know it was possible.
Annabelle wants to share news of the progress that's been made with her husband, Grant.
That's incredible. The original tumor is so crooked and angry, and then it's down to, less than a pea.
Well, that will make hopefully the job for the surgeon easier.
Exactly, exactly.
It's really brought it home, both what it was and what it is now, and I think is hugely reassuring for the next phases of the treatment.
It's nice to have been able to have this 3D vision, and I suddenly feel that I had my question answered.
Seeing the results in 3D has shown Annabelle just how effective the chemo and trial drugs have been. But she still needs surgery to remove what remains of the tumour.
I'm a bit nervous about it, but I'm sure, I have full trust in the team.
The chances of surviving breast cancer in the UK has doubled in the last 40 years. Catching the disease early significantly improves outcomes. Here's Dr. Karan to explain the symptoms to look out for.
It might sound very simple, but early detection saves lives, which is why doctors go on and on about regular self-examination. When you examine breasts, it's important you don't miss out on these 3 areas. One is behind the nipple. This is a place where people might not think to examine, but actually cancers can be hiding underneath. The armpit area. The breast tissue actually extends towards the armpit, so it's important to examine this area as well to check for lumps and other changes. And your collarbone is where lots of the lymph nodes that supply the breast drain into. And remember, it's not just about lumps. There are other things that are not lumps that you should be aware of as well. Nipple inversion or any other changes around the nipple. If in doubt, get it checked out.
That is what's causing your pain.
Oh, really? Earlier in our imaging centre, Tina and daughter Kirsty were able to see in 3D the slip discs and bony growths that were pinching nerves and causing Tina's pain.
I can't button these shirts up.
But she has other more worrying symptoms that she wants Dr. Dimitri to explain.
I'm finding it hard to differentiate with temperature. When you turn the hot tap on, it starts coming out cold, and I'm not quite sure when I've reached the point where I shouldn't be touching it, that I could burn myself. My hand feels like I've left it in a freezer. And we've nicknamed my glove Sooty because my husband, or they all think it looks like I'm wearing a puppet on my arm.
It's not so much the glove, it's the way she carries the glove.
I carry it because my arm aches, my shoulder aches sometimes, and my back, and I get comfort out of carrying my elbow. I also wear them because holding metal knife and fork sends shooting pains, so the glove stops that happening. And I wear them on both hands if I'm eating. I'm finding it really hard to cut certain foods.
You're up now.
No, could you give me a hand, please, darling? Thank you. I prefer not to have to. I do feel embarrassed, yeah. I don't like it.
No, it is, you can see people looking and wondering why.
But if I'm in trouble, I know she'll do it for me.
I'm there.
She's there.
Just watch that gap by the...
I've lost confidence in myself. My ability, my appearance. It's like an old lady has taken over, and I don't like her very much.
Dr. Dimitri has identified exactly what is causing these peculiar symptoms.
So I'm going to lie you down again. So here you can see the spinal cord, and we'll put you down in the same position so you're nice and comfortable.
The smoking gun can be found at the next level up from where her nerves are being pinched.
You have a look down there, you'll be able to see just underneath.
Am I looking under?
Yeah.
So you're on your front this time.
Yeah. So you can look straight down and see where that...
I need to come over there, sorry.
Yeah.
Right.
You can see where that disc is pushing on the spinal cord.
Can you see that there?
Oh, that's really compressed.
So this is why you're getting some of your other symptoms.
This time, the slip disc and bony growths at the next vertebra up are not just pinching nerves, but pushing into the spinal cord itself, disrupting the signals between brain and body and affecting everything from Tina's sense of touch to her balance.
And those other symptoms you described of coldness, instability as you're walking, that's all because the cord's being compressed.
Absolutely amazing.
This is where it's the worst. And your spinal cord will move up and down as you move your head forward and back. And as you go forward, the more you pull forward, the more your spinal cord will move. And so that's why this is rubbing against this part of the spinal cord.
So if this isn't corrected, then eventually it would move it and probably snap the spinal cord?
If this isn't corrected, it will lead to paralysis.
Right.
Is there a treatment for something like this?
Absolutely, yeah. So it's really important to reduce the pressure on the nerves and the cord, give you the best chance of recovery and reduce your symptoms.
Many people of Tina's age will have worn discs, but with much milder symptoms. To explain why Tina's are so severe, the doctors have identified an unusual feature of her spine.
If you have a look at the model here, do you see you've got one vertebral body here, and that's rubbing on this little vertebral body here.
Right.
And then there's one here and one here. And these two bones should be separate, but they're actually fused together. So over time, the level below it has had to do the work of the level above.
How did that happen?
That probably happened when you were developing your skeleton, either as a young child or in the womb. So it's something that we see quite commonly, actually. It usually doesn't cause any problems, but in your case, it has caused some increased wear and tear.
Major surgery to remove the damaged discs and bony growths is Tina's only option to prevent her symptoms. But it might not necessarily improve them.
Once you've had the surgery, your cord will be free. You won't have any discs pushing onto it. Once it's healed, the vertebral bodies will just become one big piece of bone and keep your spine stable and stop your nerves being injured or damaged.
That's pretty scary, isn't it?
It is, yeah. But really important that you've identified it early.
The procedure itself is not a small operation, but how are you feeling about the next step?
Be nervous. I'd be a fool if I didn't say anybody having an operation would be nervous. I'm just so pleased that I've got more understanding of what's going on. I feel reassured now that I haven't imagined anything and I can't wait to get it fixed.
Are you worried about after the surgery? Do you think maybe her expectations are very high?
I think she's aware that she may never gain full normality again. I don't think that
And you may never gain the mum you had again.
Yeah, which is a really horrible, horrible thought.
Yeah, yeah.
Maybe my expectations are wrong. Maybe I'm expecting to get back exactly how it was.
Hello.
Hello. How did it go?
Brilliant. Absolutely brilliant. I had no idea that's what the inside of your body actually looked like, and it was fantastic to actually see it.
I could tell you were thinking, what could I have done differently? What can I do differently?
I don't feel guilty thinking I've actually brought this on myself by being active. We're taught to look after ourselves, we're taught to be active.
And now you're going ahead into the operation. Has seeing that changed the way you feel about the surgery?
It's made me understand it a little more, and hopefully I will be taught afterwards what my limitations are, and I'll have to abide by them because I obviously don't want anything like this to happen again.
You're going to abide by limitations?
Yes.
You heard it here.
Yeah. We've got witnesses. We've got witnesses, Kirsty.
I will try. I will try. Yeah.
Tina got loads out today. She really got to understand her body, her anatomy. She got to understand her symptoms and where her symptoms were coming from. And she also got to understand some of the surgery that's going to help her feel better afterwards. I think the surgery is quite a daunting thing to have done, but now Tina really understands why she's having it done, why it's important to have it done, and also how much it's going to improve things for her. Now it's up to Mr. Russo, the surgeon, to take things further and do the operation.
So this is where we were when we started. So shall we see how it went?
A month ago at our imaging centre, Annabelle found out that chemotherapy had successfully reduced her 8-centimetre breast tumour down to just over ½ centimetre.
That's nice. That must make you feel amazing.
Yeah. To give Annabelle the best chance of recovery, the doctors decided she needed a mastectomy and reconstructive surgery. Today, Annabelle is at Addenbrooke's Hospital for her operation, overseen by consultant breast surgeon Professor John Benson.
I never had to go through surgery before, so it's all new territory. I'm a bit apprehensive about it.
Recovery from breast surgery, is relatively rapid, and patients will often be pottering around at home, within a day or two.
Scissors, please.
By removing the whole of the right breast, Professor Benson hopes to eliminate any cancerous cells and give Annabelle the best chance of recovery.
Okay, I think we better make the other incision, actually. Can I just have a big swab to put the breast on?
As part of the operation, Professor Benson is removing a small section of tissue for the pathologist, who will examine it to see how far the cancer has spread.
We are very reliant on the pathologist doing a very thorough examination, and it actually takes 3 weeks for them to completely assess the mastectomy specimen, and that provides very important information on the long-term outcome of Annabelle.
Once the breast tissue is removed, Professor Charles Malata immediately steps in to perform reconstructive surgery.
And I need some light, please. The main advantages of doing it at the same time, it's much better for the patient psychologically and emotionally, that they've not just lost their breast, but at least we've made a semblance of a breast. So just in between, but not too deep because the implant is just underneath here. So someone needs to record the time we're putting this on, please. Perfect. And now we've got something which looks like a breast mound. The operation has gone very well, not just the cancer side, but also the reconstruction part of the operation.
Following the surgeries, Annabelle will have to wait for her pathology results, which will tell her if she's cancer-free and what her long-term prognosis will be.
With breast cancer, we know the science is better than it's ever been on treating it, but that there isn't a clear answer. So you can't go in for an operation, come out and think, thank goodness that's over. There is a long, long journey to go. And so I guess the more you understand about what's happening inside your body, the more you kind of have tools to help you on that journey.
In one of our imaging centres, watched on by daughter Kirsty, Tina was able to finally comprehend the severity of the condition by coming face to face with her own spine.
I've got more understanding of what's going on. I feel reassured now. I can't wait to get it fixed.
Today, at Charing Cross Hospital in West London, 73-year-old Tina is scheduled for major spinal surgery.
Knowing that I've got to have the operation is a no-brainer, really, because if I don't have it, I know it could cause me to be paralysed.
If you did end up paralysed, it's losing who you are.
That's not going to happen. I'm going to be fine. Okay. I'm going to be fine.
But yeah, scary.
So we're planning to do a neck operation, and we're decompressing the spinal cord from the front.
To avoid potential full-body paralysis, Tina's life-changing surgery will be carried out by consultant spinal neurosurgeon Salvatore Russo. He'll be operating in tandem with fellow surgeon Mr. Mobasheri.
I think pretty much this case is a mandatory, isn't it, to get on with it and at the very least halt her deterioration of neurologic function and hopefully improve her.
Two of Tina's squashed discs and small bony outcrops on nearby vertebrae are pinching the spinal cord and nearby nerves and must be removed.
Happy to start? Okay, starting then.
Mr. Russo first cuts away Tina's lower damaged disc.
This is all the cartilage that we're taking it out from the disc space.
And painstakingly snips off the rogue bits of bone.
Once that part of bone goes, then the pressure on the nerve is released. That's the important piece there.
Very close to the nerve.
He works just a hair's breadth from Tina's exposed spinal cord, requiring the utmost skill.
That's the spinal cord coming into view. This pinky grey outline at the back, so it's done with great care.
The empty gap where the disc was is now filled with a precisely sized piece of bone from a donor.
We know roughly the size of the space that we have created there, which is around 7 millimeters. Just the right fit.
Perfect, yeah?
Very good, very good.
Mr. Russo must now repeat the process on the second squash disc on the level above before stabilizing the neck with a metal plate.
Although it seems like a little piece of metal, actually, there's a lot of technology involved with it.
The plate system is acting as a scaffold for that bone fusion to take place.
Picture. I think it looks good, no? Yeah, perfect. Thank you. Very happy. Yeah, I think it looks good.
With a section of her spine now fixed in place, Tina will experience reduced flexibility. But the discs and bone growths pushing on her cord and nerves, putting her at risk of paralysis, have been successfully removed.
Yeah, we've done the right decompression. It looks stable. Yeah, no, I'm very happy.
In Cambridge, it's been a month since Annabelle's surgery to remove a tumour and breast tissue.
I mean, I never had surgery before. You know, it's for me, it seems a long time to recover, but it's perfectly normal. It's just like keen to get everything back and be able to, you know, take care of the kids a bit more hands-on.
Hey. She's come to get the results of her recent surgery and to find out what the next stage of her battle involves.
Hello! Annabelle and Grant, good to see both of you.
I'm joining them to meet Annabelle's oncologist, Professor Jean Abraham.
So how do you feel about seeing Jean again today?
We're always looking forward to speak with her and understanding a bit better the reduction of risk of reoccurrence.
So is that one of your big concerns for both of you, that it comes back?
Yeah, and I think that's for everyone with cancer.
And Grant, is that really your focus as well?
It's the only focus, I would say, at this point, because we've done everything we can for the original cancer, and now that's the only focus, is getting her healthy and keeping her healthy.
Yeah. Well, shall we go inside? Yeah.
So the surgery was very successful and you made a great recovery. All the tissue was taken away and everything that had any cancer in it was removed. So as far as we can detect, there is no cancer left.
That's amazing.
At the moment, we've done everything for the cancer that was here. Now it's not here anymore. I guess we want to understand a bit what we can do to prevent it to come back.
Because there was 6 millimetres left in the surgical specimen that's taken away, not in you, but in the surgical specimen, and because that 6 millimetres had a lot of cancer cells in it, and that's something we call cellularity, so it's quite rich in cancer cells. We're going to have a discussion about what the potential options are to manage that risk of the disease coming back. Yep. And it is only a risk. So the reason this is complex is because some of the evidence about what to do in this situation says that there is some benefit in giving certain types of tablet chemotherapy. And some of the trials show that actually there isn't much evidence. So there are 2 key messages I want you to take away today. The first is there is no cancer that we can detect left in you. The second is we make a decision based on you as an individual and your feelings about the risk, and there is no wrong answer.
Annabelle was always going to have radiotherapy following surgery, but she's now got to decide whether to have further chemotherapy as well. After the successful surgery, her treatment journey will continue.
You know, it's great progress, great result, but there's still a but. And I don't think I'm yet in a celebratory, you know, it's not there yet.
It's not back to life as normal, but it's an adjustment.
I'm trying to squeeze it together to get some strength in my fingers.
In Harrow Weald, following major corrective surgery on slipped discs in her spine, Tina is making a slow recovery. She's still experiencing some numbness in her hands 14 weeks after her surgery. So Tina's meeting up with Dr. Goody at our centre to find out the long-term prognosis from her surgeon, Mr. Russo.
Please take a seat.
Hi, Mr. Russo.
Can you fill me in on how the operation went, please?
I think they went very well. I mean, we removed 2 discs and then we replaced them with bone taken from a cadaver. Then they are stable, they're fusing.
And if Tina had not had the operation, what could have happened to her?
The surgery, what it does is he prevents further deterioration in terms of function. If left untreated, the condition will cause disability and inability to walk.
You've been through a lot, and I'm sure you've got loads of questions to ask Mr. Russo.
My main concern is my hands. Will the nerve endings ever get back to normal?
It's a symptom that gives a burning sensation in the hand. It's called burning hand syndrome. And this tends to get better in about 50% of patients, but it takes time. We'll have to wait and see what will happen. From a functional point of view, I think she's done very well. She's got most of the function, got good dexterity of her hands, steady on her legs, and this is what we want her to preserve for the rest of her life.
Since the operation, she's lost mobility of her left arm, and now she seems to be improving daily.
I'm now going to the hospital and having regular physio every week, and that's come on leaps and bounds. It's really improving. I still can't touch the top of my... I can come up to about here now, because I do the exercises every day.
I bet you do.
I'm determined not to let this get the better of me. I want to get back to normal for Kirsty's sake. She's getting married soon. I want to be right for her wedding. I'm going to get there.
Tina's rehabilitation is totally focused on her daughter Kirsty's upcoming wedding.
I want to be able to dance with you at your wedding and have that jive that we always do.
Well, the most important thing for me is you being there. It doesn't matter how you're there, you're just there.
Oh, darling,
but if we can dance...
Oh, it'd be brilliant.
Oh, my God, how good would that be?
Yeah, we'll do it. We'll do it.
Following her mastectomy and analysis of the type of cancer removed, Annabelle had to decide whether to have further chemotherapy to reduce the risk of it returning.
Water.
You have to say the word before picking up the cow.
Okay.
There is a possibility of doing another chemotherapy, but we are unsure about the effectiveness of it on my type of cancer. So it's a bit of a gray area, but without a proven impact on the risk of recurrence. But I choose to undertake this chemotherapy because even if there is 1% chance of reduction of risk, I wanted to do it.
Seeing the initial size of the tumor and seeing that shrunk down, and then also having the results in the mastectomy to back all that up, I think we're on balance positive, and we know that there's a little bit more to go, but we're really committed to it.
Family is everything, right? And when you see the kids around playing and blissfully unaware of what's going on, you just think you've done a good job. Well, I have a good team. It works well. We have been married and been together for a fair amount of time, and we've successfully navigating through the ups and downs of every family, and so far so good.
Picking up the pieces post-pandemic, Hospital revisits the Royal Free tomorrow night at 9 as it journeys down the road to recovery. And it might have missed your algorithm, so I'll tell you the Instagram effect is starting now over on BBC Three. And the camera feeds first here on 2. Great British Menu, next.